CareMe approach. Life is full of burdens, but there are life-threatening ones. Cardiovascular, renal, and metabolic disease are amongst these burdens. Together, CVRM conditions are leading causes of death across the globe.
Approximately 1.2 million people die from chronic kidney disease each year.
Almost 290,000 people die from heart failure each year, and approximately 1.5 million people die from diabetes each year. Let alone, when these diseases are being treated separately, a major burden on patients and healthcare systems worldwide is created. Despite the close association between CVRM diseases, without having the right infrastructure, diagnosis and addressing shared risk factors are more challenging in clinical practice. But for every burden, there is a relief. And we at AstraZeneca are investing in a new approach that cares about patients. CareMe. We strive to understand the development and implications of each condition, and also the interactions between two or more conditions, aiming to create a CareMe world. We recognize the full patient and see the full picture. CareMe World is a health-centric approach where the commonalities between CVRM diseases are clearly seen, understood, and treated, thus enabling a better patient management. Management spares patients from going through the hassle of other diseases. Managing type 2 diabetes patients includes protection from comorbidities and cardiorenal events. Comorbidities, like heart failure, have an increased risk of occurring in patients with type 2 diabetes. Includes protection from comorbidities and cardiorenal events. Heart failure is an early and under-recognized complication of type 2 diabetes. The risk of developing heart failure is more than six-fold. Within 5 years after diagnosis, almost 70% of patients with type 2 diabetes had left ventricle dysfunction, and approximately 40% of type 2 diabetes patients will develop diabetic kidney disease. The heart and the renal systems are closely linked together. Protection is always the best intervention. This is why intervention is key to protect the heart and kidneys and reduce the risk of heart failure and renal diseases in patients with type 2 diabetes. Hence, the need has been declared for a type 2 diabetes therapy with cardiorenal benefit.
DECLARE is the largest, broadest, and longest SGLT2 inhibitor cardiovascular outcome trial with 17,160 patients randomized across 882 sites in 33 countries between May 2013 till June 2015.
17,160 patients were randomized 1-to-1 to receive either dapagliflozin 10 mg daily or placebo.
DECLARE has the longest sodium glucose cotransporter 2 inhibitor cardiovascular outcome trial follow-up period of approximately 4.5 years.
DECLARE, the broadest SGLT2 inhibitor, CVOT with majority of patient population did not have established CVD. DECLARE met its primary safety endpoint.
Dapagliflozin reduced cardiovascular hospitalization for heart failure regardless of their history of existing cardiovascular disease or heart failure, 27% reduction in hospitalization for heart failure and reduced renal disease progression across estimated glomerular filtration rate, subgroups and in patients with and without established cardiovascular disease.
In type 2 diabetes patient population, most patients do not have established cardiovascular disease, where SGLT2 extend benefits of cardiorenal to broad patient population. DECLARE TIMI58 confirmed the well-established safety profile of dapagliflozin in a broad cardiovascular risk population.